Hi, I'm Dr. J. Varma, and welcome to Thermometer. On this channel, I check the temperature of health in the United States and around the world and give you expert insights on infectious diseases and public health. I'm pleased today to welcome my friend and colleague, Dr. Jon Epstein, for our episode in this series called Inside Bird Flu, where we discuss the latest news about the H5N1 epidemic in the U.S. and around the world. Hey, Jon, how are you doing today?
I'm good, Jay. How are you doing?
I'm doing well because it turns out we may never have to talk about bird flu ever again, it sounds like.
Is that right? Why is that? Is it gone?
Well, here's the challenge. Okay. So the reason we're having this episode today and the topic that we're going to discuss is the question of, is bird flu over? Do Americans get to basically say, hey, let's put that in the past and not worry about that? And the reason we're saying this is because there's been an announcement in news that the US CDC is changing its status on bird flu from being an emergency response activity to now a routine activity. Basically, what CDC has reported is that since February, it's been monitoring infections in humans and has not recorded a single new case since February. And we're now in July. Okay. So in 5 months, CDC hasn't recorded a single new case in humans. And so, which leaves the human health case count from H5N1 at 70. And so in response to this, CDC is now saying it's ended its emergency response activities to H5N1, and then it will now put any updates about bird flu just as long as part of its routine information sharing that it has regarding seasonal influenza. Now, I've got a lot to say about this topic, but Jon, let me first start with you. What's your first sort of reaction to this?
Well, asking the question, is bird flu gone, is silly. We know it's not. And, fortunately, the U.S. Department of Agriculture is continuing to do surveillance on poultry farms for H5N1. So we have weekly updates to data that you can find on their website that show that H5N1 is still present on poultry farms. And I think where USDA is shifting its focus right now is really controlling the outbreak in poultry so egg production can ramp back up to levels prior to this big epizootic, and prices can come down in the store, which is the big political reason I think that everyone's focused on bird flu, is really, keeping costs under control. But we know that as long as bird flu is circulating, not just on farms, but in wildlife, it is going to continue to present a risk in terms of spillover to both domestic animals and people.
Yes, exactly. And I think this is where, you and I believe very strongly that, to use a nice little metaphor, that we don't want to be Chicken Little and running around saying that the sky is falling when it's not actually falling. But we know that this is a virus that, because of the number of mammals that's infected and the speed with which it's done that it really is just a matter of time before it spills over and essentially becomes a disease of human to human transmission. But as you and I have said all along, we have no idea when that could happen. That could be 1 week from now, it could be 1 year from now, or it could be 10 years from now. But it is something that we need to continue to monitor. And so now starts my sort of like rant about this. First of all, CDC has been completely quiet ever since the Trump administration took over, not just about bird flu, but about all diseases. We have literally not had any press conferences with either an acting CDC director or subject matter experts talking about emerging diseases out there. So when CDC says it's winding down its emergency response, my kind of reaction is, how did we even know you had an emergency response? Like, I did see updates. Of course, I saw risk assessments that were going on. But when I was working at CDC for 20 years, an emergency response was not simply an internal organizational activity and not simply about website updates. It was about public communication and physical presence in states and localities around the country to talk about bird flu and to raise the awareness among elected officials, to provide expert guidance to people who are farmers or people at risk out there. And we haven't seen any of that. So the first part of my rant here is the fact that this bothers me simply because if CDC is going to be doing even less than it was before in terms of public communication, to me, that means we're really potentially closing our eyes and closing the public's eyes to what we know is a real potential threat to the health of the United States, both our animals, our food supply, and to humans, of course. course.
Yeah, and I think you're touching on a real conundrum in public health is that there is a such thing as disease fatigue in the public, where if we're constantly sounding the alarm, people will just switch off and not be interested. And the problem with bird flu is that it isn't a problem until it is. And what we know, just for a little bit of background, is we know that the virus doesn't have to change all that much. It doesn't have to evolve all that much to be better able to spread among humans. And it's one of the reasons that the scientific community, writ large, is focused on and concerned about H5N1. And in wildlife, we have already seen evidence of mammal to mammal transmission. When we saw die-offs of hundreds of thousands of marine mammals, sea lions along South America, that is not all of them getting infected by birds. All right, there is definitely, I have a high degree of certainty that there's mammal to mammal transmission that would explain this degree of mortality. So the virus is having opportunity to evolve to be more transmissible among mammals in wildlife. And we've seen infections in dairy cows, another mammal that is, getting regularly infected, where there's opportunity. So that is happening in the background. And while we are not talking about H5N1 anymore and not finding too many human cases, it's tempting to think that this is, all a big overreaction. But these processes are churning in the background, which is why we have to stay on top of it.
Exactly. And the way we stay on top of it is through monitoring human health. Okay. So you and I've talked about this on this channel before as well, too. The foundation of public health is what's known as surveillance. And that term sounds scary. When we talk about surveillance, we're always thinking about spy agencies out there monitoring people. But in public health, that is the term we use to basically say, are we tracking whether infections are occurring? And anytime you report 0 cases of a disease, the immediate question is that 0 cases reported, or is that 0 cases that have occurred? Okay.
Right.
And the difference there is that 0 cases reported means that you're going out there, you're testing, you're looking for cases, and you're reporting 0 because none have actually occurred and there. But in this situation, I'm really worried that there just simply is no testing that's going on, and people can get respiratory illnesses in this situation, especially if you're handling dairy cattle or working on a dairy farm. You get eye infections, and it's very easy for those infections to simply be missed. And the reason they get missed is when we don't actually test people for these diseases. Think about the number of times you out there or any person out there has been tested for a respiratory illness. Before COVID, it almost never really happened, unless you happen to get severely ill. Obviously, with COVID, we now have home test kits that people use more commonly. But with diseases like this, when you don't invest in testing, you're not going to see it. And the other factor here is not only is there going to be less attention than there has been to actually getting testing being available, because this isn't a routine test that's available. It's like, who is actually there to get tested? And as we're watching on the news all the time, seeing these immigration raids that are going on, I find it hard to believe that our agriculture system in the United States, which is entirely propped up by immigrant workers, many of whom probably don't have legal documentation, I find it very hard to believe that these are people that are very willing to write down their name, birthday, their home address, and to put it on a paper slip and to have somebody collect a swab from them and get information about their health.
Absolutely. I was going to bring this up. This is incredibly important. And it's also where politics seeps into public health and can create obstacles. Not only are these people going to be nervous about providing, personal information, but they're often less likely to seek healthcare when they're sick in the first place. They know if they miss a day of work, they don't get paid. And so these, this community, this population tends to, still show up when they're sick, try to plow through and work through. And if there are cases where people are getting sick with H5N1, with influenza, and still showing up at work and not seeing a doctor, then they're not getting tested and detected also. So there's even this sort of disincentive to miss work and go to the doctor when you're sick.
Yeah, absolutely. And we see this, I work in a community clinic 2 days a week that cares for a lot of people who, have uncertain immigration status, right? They're these immigrant communities, people with no health insurance or on emergency Medicaid, or essentially paying, very low fees out of pocket through what's called federally qualified health center programs. And the patients that I see in my clinic, there are fewer of them coming in that are from these communities because they are afraid of having any information being collected on them. So I know this is a topic that we're discussing that's about, is CDC making the right decision by de-escalating its response from emergency to routine activity? But we can't take that sort of technical issue away from the political context of what's occurring right now. And if CDC is going to lower its attention and resources to this problem that's occurring at the exact same time that the people we most need to get tested so we can monitor what's happening are also pulling away from the system as well. So we have less attention to the problem, and the people who would be getting paid attention to this problem are essentially going into the background as well.
Yeah. And that's going to put real blinders on us when it comes to, if there's a point in time where H5N1 breaks through and starts to, spread among people. There is still flu surveillance, and we hope that if, there's a big enough cluster of cases that gets noticed. But what we see so often historically with epidemics is by the time you detect that first cluster, it's the tip of the iceberg and you're almost too late. You really want to identify those first initial cases and make sure you're controlling spread at that point. And that gets this much harder when resources disappear for surveillance.
Yeah, I mean, so the last thing I wanted to discuss before we sign off for the week is, so Jon, what is your best theory? So, okay, so I want to just be very clear and transparent here about my humility about all this stuff. Mm-hmm. These are microscopic things that are constantly replicating. And I have no special insight into being able to, as we said before, to know for sure whether the absence of cases since February is real or whether it's what we consider an artifact of not looking carefully enough. I have my very clear biases, as I've made clear, that I think that this is more likely than not due to not looking carefully enough. But it is absolutely possible that this virus is behaving in a way that we just don't understand, and for some complex interplay of reasons is no longer as much of an issue for human health. So I fully acknowledge that is absolutely a possibility out there. And but Jon, what is your best thinking on what's going on right now and why we haven't seen any human cases since February?
Look, we're seeing human cases in Asia that are popping up. So infection is rare, but it does happen given exposure to infected poultry. That's typically how people get infected. And given the pervasiveness of H5N1 on US poultry farms, I still think people are getting exposed. And I do think that, it's possible that there are cases out there. Do I think it's common and we're missing it? No, I don't think there are many. It's possible we're missing a few. And so my worries tend to live in the more systemic realm, where I worry that, if we start to have a bigger spread, that we're going to be kind of too late to really contain it. But I don't think right now that there's a huge amount of spread happening in the background either. I mean, I feel like that if that were the case, there'd be enough cases that even our less sensitive surveillance would pick up on it, because we don't have no surveillance. It's not that we're totally not paying attention anymore. So I'm with you. I think there probably aren't many cases. I'm not saying there are none, but I do worry that, we'll be too late to the party when we, do see that first cluster.
Yeah, absolutely. And so we're going to wait and see, and we're going to continue to provide updates to everybody out there, because this isn't a virus that is going to go away. At some point, it's going to mutate and continue to cause challenges to animal health, to our food supply, and then, of course, obviously directly to us and to our pets. I forgot to mention that as well, too, because that's always an important thing to keep in mind.
And Jay, we should also mention too, in terms of vaccine development, there are vaccines for H5N1 that are in development, but one thing that was a little, I would say, worth noting, and I'm not a fan of this decision, but funding was pulled from Moderna, who are working on an mRNA vaccine for H5N1, and it was hundreds of millions of dollars that had been contracted to them to develop this. And given that what we know about safety and efficacy for mRNA vaccines, that they are safe and effective, this seemed like a good strategy. And going back to vaccine production in this sort of older method we used to use, which is developing the vaccine in bird eggs, that can take 6 months to a year to develop. I feel like that, when we're going to need this vaccine, it's going to take a while to ramp up production and get doses out there. So we're going to have to pay attention to this space as well in terms of our countermeasures and what we're developing for H5N1.
Yeah, well, without, I'm deeply worried about that issue. I know it's something we've talked about before as well too. I mean, mRNA platforms have unfortunately become part of this bizarre right-wing conspiracy theory when they are actually an extraordinary scientific discovery and give us the opportunity to develop vaccines that are safe and effective to make them faster than ever before. And you're absolutely right. In addition to not looking carefully enough for diseases, which is what might be going on right now for H5N1, we also run a very real risk that when it does pop up, we're not going to have the countermeasures that we need available to us. So let's keep trying to raise awareness as much as we can. If you like hearing about these issues, please hit the like button. Please subscribe. Please share this episode with other people you out there. And even if CDC's emergency response is winding down related to this, Jon and I are going to be here regularly to keep you updated on the latest news, because it's important for us to all try to stay safe, keep our food safe, keep our pets safe, keep our families safe, keep the animals in our life safe. And we try to make sure that you have the information you need to do that.
Yeah. Thanks very much. Be well.